Now we're going to talk to Dr. Elena George. I understand she's against healthcare reform, but we're going to find out how. She's against this proposal, from what I understand. She has written for a variety of websites, including BigGovernment.com, YourBlackWorld.com, and NewMediaJournal.us. So, Dr. George, welcome to the Young Turks.
Thanks, Cenk. It's a pleasure to be here.
All right, great to have you on. So, first let me understand where you're coming at this thing from. Am I right in saying you're against this healthcare reform legislation in general? And why are you against it, if that's true?
I think I'm coming from the position of the doctor and patient relationship. I'm not about, people who don't know much about what it's like to treat patients, and from a patient point of view, what it's like to be sick and really need to get care. Nobody seems to be taking that tact. It's all about politics, and it's all about trying to one-up each other and about getting in the next round. But it's not really realistic about what it's really like on the ground level.
I hear you, but so why is the bill wrong in regards to that topic?
Well, where do we start? Let's go with the last thing that was said, that it was, trying to fleece the big cats and to tax them because they have this Cadillac plan. When you look at the numbers, that Cadillac plan actually affects middle and working class people, because those are the people who have the PPO plans, which is the majority of them out there. Now, that's going to be taxed 40%.
That's right.
So what that will end up doing is taking away patient choice, because ultimately that plan allows people to go to the doctor that they want to, when they want to, without a gatekeeper.
Dr. George, I think you're right, but that's the plan that the liberals are against. They don't want the Cadillac plan taxation. They want the House version, which taxes the top 1% instead of taxing the plans themselves, because that might force some Americans to not have their health care plan anymore or lose it.
Well, yes, the House was, but the Senate bill isn't like that.
Right.
And the problem is we have no idea where this is going to end up. So we have two bills. Neither one is very good for patient or doctors in this country.
But in that regard, you like the House version better, then?
No, I can't stand the House version.
Okay, why? What's wrong with that?
Well, what it does is it takes away patient choice.
Why?
By subsidizing community-based health care. So as a solo practitioner, you're going to have a choice. Either you be employed by a hospital or you join a community-based health care center, but there's no way you'd be able to stay in business by yourself or with another person. It aces you out because the reimbursements drop. They already dropped 20%. They're going to go even lower. So you have no choice to keep your doors open, to have any patient base that's going to be able to support you. You're going to have to get a salary.
Dr. George, flesh that out for us a little bit better, because a lot of people, of course, in the audience are not doctors, so they don't know exactly what you're referring to. So why would this bill, in your estimation, prevent doctors from setting up their own private practice?
Well, look at where the numbers are now. Everything's based on a Medicare rate. Over the past 15 years, the Medicare rate has dropped every year. And it's fine. I mean, I don't have a problem with it, but it's reached the point where it's stay open or get bigger or see more patients or add extenders in order to keep your doors open. And that's the major problem with healthcare. There's less doctor-patient contact because doctors have to see so many people coming through their doors that they actually have less to do with the patient and more to do with administration. This bill actually exacerbates that.
But Dr. George, let me flip it on you, because I hear you, and I've got a couple of doctor friends who have complained about similar things, and then they say private practice is made even harder because getting the medical malpractice insurance is so overwhelmingly costly, especially for OBGYNs, that it's nearly impossible to do a private practice. That forces you into the hospital, right? So I hear that perspective. But from the consumer perspective, our perspective, Medicare does keep those costs lower. And from a taxpayer perspective, it keeps it lower and hence keeps the budget lower and the deficits lower. So you can see how that's good for us.
That's absolutely untrue.
Why is that?
The disconnection. Medicare actually jacks up the price for people who don't have health insurance because they have to make up the shortfall with the people who can actually pay. So what happened was initially Medicare became the template for reimbursements. All insurance follows the Medicare rule. So they might go maybe 20% higher than Medicare, 30% higher than Medicare, but it's based on the Medicare rule.
Right.
And because now it's not based on anything in terms of real cost, it doesn't take into consideration office equipment, office staff. All those costs have gone up, but the reimbursements have gone down. So what that means, and it happens in hospitals too, it's called cost shifting. And the insurance fees or the insurance premiums have changed. If you look at what's happened over the past 10 years, it's amazing. I had patients coming in with $10 copays 5 years ago. Now I have people coming in with $5,000 deductibles, $10,000 deductibles. So the cost hasn't changed. It's just been shifted from the insurance company to the patient and to the doctor. So it's a big sink. The doctors are getting, and the hospitals are getting less reimbursement. The patients are paying more, and it's getting sucked out of the system. But no one's getting any. No one's happy about it, and that's only going to get worse.
There's so many problems with that, okay? Because, the way you framed it, it seems as if these costs are constant. No matter what, these things are very, very expensive, and they're going to cost that much no matter what. And hence, if you take it out of here, well, then it's going to pop up over here, right? But it's not like that. I've seen reports from all over the world in how they do different medical systems, and it costs so much less in other countries, including developed countries like Japan. The mammograms cost a fraction of what they cost here. The MRIs are the same. Overall, they pay $2,500 per person for health care insurance. We pay over $7,200, I believe. So almost 3 times as much. Their average life expectancy is 84. Ours is 78. So we're way overspending and not getting the results.
Well, you can't compare apples to oranges. The United States is not like Canada. It's not like Japan. It's not like the UK. Yeah,
that's because we have a terrible insurance system.
Well, that's one of the problems. The insurance companies have been allowed to run amok. There's no real cost control in terms of them. They've actually taken that money from your premiums and mine, and they've used it for their CEOs. They've used it for gatekeepers. They've used it for doctors to deny health care. And nobody's saying a thing about that. They even have monopolies in certain states, so you don't have a choice.
So, Dr. George, that's the thing.
If they were to do something about that, I'd be happy.
No, so then we agree on that, and I'm happy to hear that. So, then you would support the public option, for example, or Medicare buy-in, something to create real competition to these insurance companies that are taking so much money out of the system and making everything more expensive for all of us.
But the problem is there is no public option. If you look at the House bill and the Senate bill, do you know who's going to run the public option in the exchange zone? It's going to be run by United Healthcare or Aetna or Blue Cross and Blue Shield. There is no innocent bystander in this. These guys are going to be taking money from all areas. I have a problem with that.
So in that case,
why should they be running it?
In that case, you're saying that this bill is too watered down. It's not tough enough on the insurance company.
If in its pure state, I was all for not single payer, but having some sort of game, something in the game that would actually bring the cost down, who wasn't in it for profit, and who had no other interest but to serve as many people as well as it could possibly serve them. But that didn't happen with the bills. The bills got changed, unfortunately. The House bill is bad. The Senate bill is worse. And they actually don't do what they say they're going to do. What they're going to do is tax us. They're going to tax us out the yin-yang, and they're going to deny us care. Because how can you actually have more people covered and have it cost less and get more? That's impossible. That's what they're promising.
Okay.
It's impossible.
We're talking to Dr. Elena George. She writes for BigGovernment.com, NewMediaJournal.us. And if we had this kind of debate throughout the process, then maybe we could have achieved some sort of bipartisan compromise. We could have had an intelligent discussion of the issues. Unfortunately, that's not how it unfolded. But given where we are, Dr. George, if we leave the status quo, we don't do any of these bills. And by the way, I don't like the bills. And I'm scared to death that Senate bill is so weak and gives so much away to the different insurance companies, et cetera, that I have the same concerns you do. That I think our premiums are almost certainly going to go up, and those guys are going to win and we're going to lose. But if we don't do anything, the status quo seems so unacceptable. So
agreed.
So one, there's that issue. Two, since you already agreed to that, and that's great, what would you do? I mean, how would you change it? If it's not this, would you have gone for a stronger public option? What would you have done?
I would have made antitrust. I would have made the insurance companies follow antitrust. There's no real choice in insurance companies. There's about 4 big ones, and they basically own subsidiaries all through the country. So they're actually able to set their prices, even though they claim that they don't. They actually do. And the government actually is the floor of what they set. The second thing I would do is tort reform. It's time to have a change. I'm a doctor. I don't want anybody practicing medicine that's going to hurt somebody or kill somebody. So I'm not against suits, but I am against frivolous suits. So why don't they change the makeup of this so that whoever loses the case has to pay the court costs of the one who wins the case? That would stop people from bringing frivolous, suits that it's, you lose. If I lose, big deal. If I win, I get a windfall. There has to be some consequence, so there's some thought. The third thing I would do is allow people, doctors, to write off bad debt. So if I see a patient and I don't get paid, I can't go after them and I can't collect it and I just ate it. But I'd be more than happy to see patients for free or basically give them a reduced rate, write off the rest if I could have a tax break on it. So you actually have some positive reinforcement to see patients who can't afford it, or if they can't make their bill, you don't go after them, so that you can actually give people a break. Those things would actually work. They wouldn't cost a lot of money, and it would make people, it would do it in a positive way instead of hurting the entire system and making everybody enemies of everybody else. And I'm really tired of the left and right paradigm because they're all the same. It's basically us against them. It's not Democrat, it's not Republican, it's us. All of us, we're all in it together.
Dr. George, if we were going to do that healthcare summit that Obama's going to do on the 25th, instead of the Republicans and Democrats, this country might be a little better off. Okay,
I agree with you.
Because, on some of the stuff, and I agree with you, on some of it I'm a little 50-50. Like, tort reform is very important, and I get that. And it's because what a lot of people in the country don't understand is it's not the doctors being sued that's so bad. It's how much the insurance charges the doctors, right?
That's right.
For getting sued. And that's what's killing them in terms of costs. And maybe we should do reform on that insurance as well, because I can guarantee
absolutely.
you they're making an unbelievable profit off that as well, right?
I looked into this. It's amazing. Only 5% of doctors actually get sued. 5%. It makes it sound like everybody and their mother's been sued sometime in their career, and it's not true. And of that 5%, 80% win their case. But the way it's all framed, it's like, oh, I'm going to get sued, I'm going to lose, and the insurance companies jack those rates up without any regard to reality, whether or not you've been sued.
So, for example, that issue has two sides, though. Okay, so on the one side, it's the point you're making. A friend of mine's OBGYN, he has to pay $200,000 a year in insurance.
Insane.
That's insanity. That's just absolutely nuts, right?
Mm-hmm.
Now, the flip side to that is, if you do the system that you're suggesting, then the possible cost of bringing a lawsuit is so high that almost no one is going to bring a lawsuit because they don't have the wherewithal, they don't have the money, they don't have the power.
No, I don't agree with that. If somebody got hurt, and look, I actually review medical malpractice suit cases, so I see things go on, and I give opinions that are actually against doctors on most of those cases. No one's afraid to bring a suit if it's appropriate. But there's some frivolous things out there, let's face it, and your kid didn't get into the right college and something happened in the OBGYN suite and they get sued 15 years after the fact. That's inappropriate.
So my bottom line on that is, no, I hear you, and my bottom line on that is, I might draw that line in a different place than you draw it, but that's something we can have a reasonable compromise over. Okay?
Absolutely.
Right.
At least have parameters.
Right, exactly. So finally, and I want to bring up one other idea with you and see what your thoughts on it are, because it's a pleasure to talk to someone who actually has real disagreements rather than secretly supporting corporate America and pretending to be conservative.
No, I'm definitely not pro-corporate America. I can tell you that one right now.
Yeah, that certainly is clear. So what do you think about the idea of paying doctors, I believe as the Mayo Clinic does, where they do a flat rate and they don't charge per service. Hence, they remove the incentive to inflate services and to order more tests, et cetera, because that seems to have had a good result in containing costs. What's your thoughts on that?
There's actually a report that came out about the Mayo Clinic. They have an extension in, I think it's Arizona. They're going to stop taking Medicare because they can't cover their own costs. So that all of those, it sounds good. It sounds fabulous if you just make it a flat rate, but it doesn't work that way. And I have to tell you, most doctors don't order tests because they can order them. They order them for a reason. And you can't order tests because they won't be pre-certified because you have to have a reason. So all of this, they've used the
no, I disagree there.
Emotional, teaser with this. But in actuality, most doctors don't do this. They see their patient. They do the minimum they need to do to get the job done. But they need to actually be able to keep their doors open.
No,
That's
Dr.
what it's
George,
coming to.
I don't agree with you there, and I'll tell you why. Because on a case-by-case basis, we all know many lovely doctors, and generally they want to do the right thing, et cetera. But when you look at the macro picture, and doctors get paid more based on tests, all of a sudden the number of tests start to rise and rise and rise. So incentives and disincentives matter. There was a great article written, I forget in which magazine, it might have been the Atlantic, about a county in Texas versus
I've heard that one. I've heard that. I read that article.
And they do
that
3 times as many
hospital.
tests.
I don't agree with that. I don't get paid for ordering a CT scan. I don't get paid for ordering an ultrasound.
Because it's different
Doctors
everywhere.
Doctors don't get paid for ordering tests. That's not true. Hospitals do.
Right, but
if doctors work for hospitals, they might.
See, that's why.
But they don't. That's not a private practitioner.
Dr. George, that's why it's different everywhere. In those counties, the doctors are not working for a hospital. They've set up a private practice. So the more they charge, the more money they take home. Hence, they have that incentive. So I think that there's a better balance to be had out there. And if you say, hey, look, the Mayo Clinic has some issues, and there's ways that we can work around that, I'd be interested to hear it. But
well,
again,
there's something called the Stark Law, which all doctors are held to. You can't make a profit on a test center, a surgery center. You're not allowed to. That's illegal. So I don't understand how that could happen. No, that's a nationwide law. It's called the Stark Law. And they watch you like a hawk. You can't do that. So I don't know if that's actually true. I mean, that's a really inflammatory story. I was pretty appalled when I read it myself. But I think that if it does go on, it's an outlier. It's an outlier if it is going on. I don't believe that that's most of the places that work that way.
And when I look at the I don't believe that, because when you look at the macro picture of the United States, there's a part of the reason why these costs are skyrocketing is that, yes, when compared to other countries, we order a lot more tests, and we do a lot more surgeries, et cetera. I mean, look at the big picture, and that has to be a matter of incentives and disincentive. It's
not, because the average doctor who does a procedure gets about, let's say, 30 cents on the dollar for doing the procedure. I mean, I don't know if you saw the article what the surgeons wrote about when the president talked about amputating feet for making tons of money. They made about $300 for doing that. This is not a money-making venture to do surgery. The actual cost of doing surgery versus staying in your office is actually flipped in the past 10 years. So it costs you more money to go out and do your case than it does to stay in the office and see patients. So you really have to understand the monetary incentives on what they say and what is actually true.
Okay.
That's a problem. So that's a disconnection for people.
I hear you. I'm going to let you have the last word on that, but I really enjoyed our discussion.
Me too.
And it's a pleasure to talk to someone who's coming at it from a real perspective, and it was good to get a doctor's perspective here as well.
Is it okay with you if I give my web address so people, if they want to read?
Absolutely. Go ahead.
It's Dr. Dr. Elena, ELAINA, George.com. And I write on a lot of things, including the food industry, which is another conversation I'd love to have with you.
All right.
We're in lots of trouble right now.
I don't doubt that at all either. So DrElenaGeorge.com is the website. Thank you so much for joining us. Really appreciate it.
Thank you. I appreciate it.